We can look forward to a break to come, but before that, we have one more very important conversation to have. You are blessed with a wealth of riches today, maybe more than you can take in, which is why we're recording these sessions, and we'll provide them to you afterwards for review. But I don't want you to miss all of the wisdom that's gathered here at this table. We are focused for this roundtable on another set of moral issues that we believe must be at the center of the conversation in this presidential election. The issues of health care and ecological justice together. And Bishop Barber has introduced in a couple of different ways now this quadrilateral, this grid that we're using to try to help people see moral issues and why they matter to all of us in this time. And so the 4 points, just to review real quickly, are we have our constitutional traditions, our constitutional moral traditions. We have the data from the best research on these issues. We've got the experience of people who have lived these issues and know it from personal experience. And then we have our rich scriptural and faith traditions that speak to us about why these things matter. Now, I am an evangelical Christian. I was raised in a house where I had to memorize the Bible. We had to memorize it in the King James Version because if it was good enough for Jesus, it was good enough for us. But a few years ago, I had the opportunity to write a book on moral values for evangelical Christians. I published it with an evangelical publisher because these are still my people. And in that book for Christian pastors, for evangelical Christian pastors, when we came to this issue, I had the opportunity to bring in a voice of wisdom who's with us here today. So I'd like to start with you, Brother Wendsler. I'm honored to call you Brother Wendsler. Let me say, for introduction, Dr. Wendsler Nosie is here with us from the Apache Stronghold. A spiritual leader of the San Carlos Apache people for sure, but I have learned from many indigenous folks around this country, a spiritual leader who is recognized by many of our indigenous sisters and brothers across the land. I wanted to start by asking you if you would tell us about your own struggle for religious freedom, because we've been talking about the Constitution, and I grew up with people who said they cared a lot about religious freedom. I'm Baptist. You know, Baptists think we had something to do with religious freedom in this country. But Brother Wendsler has been teaching me about how the people who talk about religious freedom don't have much respect for it and has been engaged in a great struggle. And share with us that and what you have been in that struggle, learning about the basic moral struggle and moral issue at the heart of this case that's now in our courts.
First of all, I just want to acknowledge in my language, ahia bika nan chikunin yasto chi shoskako chilstit di wako sterolet di na hayushet sterolet anto. What I said was I just want to thank the Creator for also bringing me here to be with you, and also to the people who live here prior to wherever they're at, blessings for them, meaning the native people. So anyway, I just want to start with that. First of all, Nagosan, in Apache, that means Mother Earth. And what I tell people across the country is that there's chapters in our life. We all have chapters. And what I've always felt was in America, we never learned the first chapter, meaning our people, what we went through, what we encountered. Just like all of you, with all the powerful words that were said during the struggle, same thing with us. Same thing. But the one thing that always kept in my mind was Hatunga, meaning that the people used to say, what did we do? What did we do to these people? You know, so when it comes to myself personally, I'm firstborn reservation. I'm talking about Arizona. I'm firstborn reservation. My mother was born in the early 1920s, and she was a product of a prison. and then my grandfather who came in as a prisoner of war. So for us, it's just recently. And so when we look back into those days, we say, don't get offended. We have the right to evaluate this country. We have a right to say what we need to say because it enhances what you guys are trying to do. Because what our people used to say is that there's going to be a time that America will cry. That's when we come out. Because America was never founded on the right foundation. And we lived on that because we could see what colonization, capitalism has done to us. And so, believe it or not, it was right up till the 1975 to up to 1980 that those elders that were passing, that were born late 1800s, early 1900s, one of the things they were trying to describe, because those are not in our words about capitalism and colonization, but one of the things they were trying to define was what happened. So what they seen in this progress was that dividing and conquer, becoming individual. And that was really scary for us because it was breaking apart the family, the essence of the family and what it meant. Because we're all intertwined to the Mother Earth. And the Mother is what, when we were born, the umbilical cord is cut. But then from there, we're rerouted into the earth. And that keeps our ties to understand God's greatest creation. And so in moving forward, our people struggled with that because we couldn't understand what did we do. And there's no word except Annikira. So when the first people came to our part of the country, they were known as, they're our relatives, I guess. They're our relatives. But we didn't know what they were after. We didn't know what they wanted. And so at that point, our people realized that, well, not realized, but seen and witnessed something that we never witnessed before was the kind of killing that was happening from elders to children and the misabuse of all our people. And they were all from federal policies based on the war, how the government created all these federal policies. So anyway, my mother, I remember I was like in the 8th grade and I gave this big speech in the public. And of course, you go back and you sit down by your mother, and I asked her, how did I do? And what she told me was, you sure lie. And I'm like, lied? She goes, we're victims. You made it sound really good, but we're victims of the past. And she goes, son, I'm really hurt because we passed that down to our children. And so now there has to be a recovery from that. She goes, but it's what they call post-war. Because the American people left us to survive with no understanding what this concept was about capitalism. But it's a good thing, my mother used to say, it's a good thing we didn't understand, because that's not where we want to be. Because where we want to be is rerouted to what God created the world to be. And that's our Mother Earth. So in leading up to today, one of the problems we have, big problems right now that was foretold in the prophecy, that they will come back after our spirit, our religion. And we are in that war. Indian country is in that war right now. Because the reason why I can say that to you, because at Oak Flats, where Reverend Barber has come to visit, and Reverend John Mendez and many others, is that these places are holy. They have deities, they have angels that we still connect to. But what we see across the country is that it's being destroyed everywhere. And in this place, they're females. You can be born there, and you can die of old age, and it has everything there for you. But we can't comprehend why America is killing all these places. Of course, it comes back down to Congress, the Natural Resource Committee, which sets laws for the Department of Energy on the critical minerals, copper, gold, lithium, nickel, and so forth. The theme is, regardless of how we discuss them, these elements are critical to our lives. So this is the statement the United States has made, and what's that referring to is that they're disregarding everything that gives life to the earth. And that's what's happening in America right now. So from the Native American point of view is that We're running out of things. There's not enough. So I also want to just leave you with...
Can I ask you one question before you do? Because you've made this important connection between the experience of violence toward people and this violence toward the earth. You also taught me at Oak Flat about that same connection, but in the positive way, when you were talking about the role that the acorn has played in medicine. Would you just share that? Because I think kind of the other side of it is the wisdom that is so missing from that violence.
Yeah, well, with the acorn, it's essential because, you take a pound of coffee, can, and you grind it, and it could feed 600 people at one serving. But also for a family of 5, it can go way beyond that. But the oak trees, it takes them 100 years to produce an acorn. So it's a vital part of what God created the world, how it feeds us. And that's why it's so important that what we say is if we're disconnected from the earth or what it feeds us, then we don't understand the earth anymore. And that's why it's so critical that we understand what the earth is all about. And so in what they're also doing is this particular place have angels. And they're being killed. They're going to be murdered, the way we see it. And so in ending my opening is what I want to say is that the federal government, the United States, asked for an EIS. But again, with John McCain passing it through as a late night writer, which gave them all the exemptions, it didn't mean anything. But in the Dog and Pony Show, we submitted our statements. But before I came back to Oak Flats, because we were removed from the area, a white lady knew the angels. She did not know the names or so forth, but she was conversating with the angels. She was foreseeing things. So when we began to do this EIS and the statements, I turned to her and I asked her, can you submit one? Because you know these deities. So she did. So in the process, it was turned over to the Tonto National Forest, taken by the United States. 2 months later, when I got the documents back, you know how we don't trust the United States government. So I went back thoroughly through the documents twice, but it still bothered me. But I was going through written stuff on the environment. But I went back to the statement, and I found hers missing. So I had a meeting with the Tonto National Forest with their attorney, and this is what he tells me. He says, I tell him, I said, there's a document missing in this package. Then he tells me, yeah? And I said, why was this lady's statement taken out? And the response from the United States was, she's a white lady. Then I said, I know she's a white lady. Why was it taken it out? Then he repeated himself, the attorney did, and said, she's a white lady. I said, okay, make it clear to me, what are you saying? And what he told me was that the only ones that can claim a spiritual connection is Native people. Then I said, wait. I said, say that again. And he said, the only ones that can claim a spiritual connection is Native people. I said, so you're telling me all the whites, blacks, Asians, and everybody else cannot? I said, oh, now I get it, why you guys can't help us. And that's what brings me here about the discussion that Reverend Barber is starting, because this is one of the things that we've said that we have to be at the table with you all, because we're all in this together of what colonization and corporations have done to all of us. So that is our fight. I know there'll probably be more questions, but that is our fight. I just wanted to give you the logistics of it. But that's our struggle right now on the religion, because our court case is based only on the religion. And that's what we're fighting right now in America.
This is important wisdom. Thank you so much, because you're absolutely right. By staying true to your faith and your tradition, you can name the evil of a power. Now, in my tradition, and the tradition that many people here share, we're also supposed to be able to name evil powers. They call principalities and powers in our text. We are not very good at naming them, but you're helping us. You're helping us. Now, one other tool we have to help us is that, when these powers are at work in the world, they hurt people, and we believe that God did give us some reason that people put, into effect and can analyze the effects. So let me introduce Dr. Sharelle Barber. So glad you're here. Thank you for being here. From Drexel University, the Ubuntu Center, a social epidemiologist. Now, a lot of us didn't used to know what epidemiologists were, but then we saw them on TV during COVID, so now we think we know. But you really know.
Yeah.
So tell us from the data, what you can see. What is the impact of this system that our brother is telling us is evil?
Yeah, absolutely. No, I'm actually, thank you for your opening remarks. And I want to just begin by saying it's truly an honor to be on this stage with two of you who I consider elders. I've watched from afar your struggles and your fights on the ground. And for those of us in the academy, it gives us strength because sometimes academics can lose their way and we can oftentimes not feel connected to the work that is going on the ground. But your stories, your struggle inspires us to keep bearing witness, if you will, to the data. And so to answer that question, I'm actually going to bring into the room a quote from who I think is one of the most profound social epidemiologists. So we all know her as a voting rights activist, Fannie Lou Hamer from the Delta of Mississippi. But I argue that she made one of the most profound social epidemiologic statements when she said, "I am sick and tired of being sick and tired."
And
I'm gonna read that whole quote for you all because I think it helps to contextualize why what we do as epidemiologists, particularly what I do as a social epidemiologist, is so important in bearing witness. And the diagnosis that she had that was so critical to us understanding the literal embodied experience of these joint systems of oppression, racism, systemic poverty, et cetera, et cetera. So in 1964, she said these words, "For 300 years, we've given them time. And I've been tired so long now that I am sick and tired of being sick and tired. And we want to change. You see, we can no longer ignore the facts and getting our children to sing, 'Oh, say, can you see, by the dawn's early light, what so proudly we hailed?' What do we have to hail here? The truth is the only thing going to free us. And you know, this whole society is sick." She said that in 1964, and she, like I said, she was arguably making one of the most profound social epidemiologic statements ever to be spoken because it was at once an observation of the embodied physical reality that she and so many Black Americans and other oppressed peoples in this country have experienced, and a declaration that enough was enough and that she would join the collective struggle for liberation. The statement spoke both of her personal experience as a poor Black woman sharecropper who was brutally beaten to the brink of death for her activism, and also suffered physical ailments, which most folks don't talk about. She had breast cancer. She had heart failure. She lost her ability to control her own body when a doctor performed a hysterectomy on her without her consent. These experiences were her personal experiences, but they were the collective experiences of Black people and other oppressed people in this country. And her diagnosis of the whole society being sick was an indictment on the ways in which we structure society so that folks are barely surviving. And we see it in the data. So for example, we are quote unquote post the COVID-19 pandemic. But have we all collectively really sat with the fact that globally we lost 7 million human beings on this earth in the last 4 years due to one airborne virus that did not discriminate but exploited the deep fissures, the deep inequities in our society? 7 million deaths globally, and that's an undercount. That's an undercount because we know that there are deaths that were not attributed to COVID that were because of COVID. In this country, 1.1 million people. That's mamas and daddies. That's aunties and uncles. That's children who succumb to the COVID-19 pandemic. And some of those deaths, not all of them, but many of them were avoidable deaths. Right. Many of them could have been avoided had we had the structures in place that allow people to thrive, had we had the adequate access to health care in every community that allow people to survive, right? So we just went through 4 years. Just March 13th was the official declaration. March 13th, 2020 was the official declaration of the pandemic being a crisis. We've gone through 4 years, lost 1.1 million people in this country, and I don't know that we learned the lessons from that. I don't know that we learned the lessons from all the root causes that caused that. For example, we sent essential workers. We coined this term essential workers, but they really were disposable. We sent them onto the front lines of this pandemic with no protection, no health insurance, et cetera, and we expected them to survive. When we did some work in Philadelphia locally, we were trying to expose how racism and other forms of oppression kind of played out geographically in our city. And we also spoke to folks on the front lines of the pandemic who were assisting communities in really building some resilience to the pandemic. And one of the women we talked to talked about her son. We talked about essential workers. These were the essential workers in the pandemic. She talked about her son, who was a custodial worker at one of the local hospitals. And during the very early stages of the pandemic, you know what his job became? To bag the bodies. To help bag the bodies. He was a low-wage, essential worker working in a hospital setting, and part of his job description during the pandemic became to help bag the bodies. Have we honored the workers that literally put their lives on the line, literally had to face the death that we were shielded from, right? We could stay in our homes, right? We didn't have to go into work. But there are people who saw it up front and personal, and we have not mourned the deaths, nor have we provided the proper provisions for those who were on the front lines. When we talk about—
Real quickly, you're saying something that this reveals about us, about our moral character.
Exactly. And then home was supposedly the safest place at the very beginning of the pandemic. However, there's so many people in our country who are unhoused or have unstable housing, right? Communities could have been bastions of hope and resources, but we know in urban and rural communities alike that there are so many conditions within those communities that set people up for the death due to COVID. For example, the food apartheid that takes place in Black communities and poor communities and other communities of color set people up to have the chronic conditions that made them more susceptible to the disease. We structured this society for death. That's how it's structured, and it plays out in the data. And then finally, to get to healthcare, we don't even have universal access to healthcare. We have this fragmented, what I call a tiered, fragmented healthcare system that is rooted in our negligence as a nation, but also really rooted in structural racism because we wanted to keep things separate and unequal. We never, as a country, wanted to provide health care for everyone. And there have been professional bodies, particularly the American Medical Association, who continuously fight against universal health care. So we get through a pandemic, we see all that death, we see what we have caused, and we still can't provide health care for everybody. Something is wrong with us.
Can I just ask while we're on this, and I'm asking a data question, so I don't expect you to have exact numbers, but just would you give folks a sense? The United States, I know, among the 25 wealthiest countries,
Right.
is the only one that doesn't provide universal health care. If you compare
Yep.
the impact that COVID had here versus what it had in those other 24 countries, what do you learn?
Yeah, so you do see that we, one, had worse impacts. We also, so the COVID impacts are one thing, but we also lost years of life as a country. So overall, we lost 2.4 years of life expectancy in this country. And that literally translates into 20 years of gains we lost in the pandemic. And then when you break it down for racial groups, for example, and I brought data because I'm an epidemiologist. If you break it down, overall, it went from 78.8 years of life to 76.1. For Black people, we went from 74.8 years of life to 70.8 years. That's 4 years of lost life just between 2019 and 2021. For Hispanic individuals, 81.9 years to 77.7 years, that's 4.2 years. And for indigenous folks, 71.8 years to 65.2 years loss of life. That's 6.6 years lost within 2 years due to a pandemic that could have been, some of the casualties to that pandemic could have been prevented, right? Wow. So it literally in 2 years bore out in the data how inequitable and how these systemic racism, systemic poverty, even ecological devastation combine to have these disproportionate impacts on folks, and as well as poor people and poor communities in this country. It bore out in the data. We literally embody these inequities. So what would it mean if we create a society where everyone, we honor everyone's shared humanity, right? And that we allow people not only to barely to survive, but to thrive. And we have the power to do that because within 2 years, we saw that drastic decline.
Thank you. Yes, indeed. Let me bring in our sister, Callie Greer. You already met her this morning on the video. She is here in the flesh from Alabama, a state. There is a lot of good in Alabama, and you represent much of it.
Thank you.
But it is also a state that continues to refuse to expand Medicaid. Tell us what that means for people in Alabama.
First, let me just say thank you for having me once again to be a part of a panel here for Poor People's Campaign. I'm from Montgomery, Alabama. Don't hold it against me. I tell you, I'm still trying to figure out how to get my life lost back from this pandemic. I left my notes on the table back there, but pandemic was one of them. You all know me from sharing my story about my daughter Venus, who died for the lack of health care insurance in the state of Alabama. Who just continually complained about a little knot in her breast tube, became stage 4 cancer. And she literally died from that after a long time of suffering and doing without. She died in February 2013. And I shared with Carolyn and a couple other folks, and my folks were people who campaigned in Alabama, that I needed to let folks know that it was more than just about that when I talk about Medicaid expansion. I had wrote down about the pandemic. I am a survivor of the COVID virus. I was fully vaccinated, and I still caught the COVID-19 full blown. After I endured that, when I quote unquote recovered, I have cardiovascular disease, I have a 3rd stage kidney disease, and I have pulmonary diseases. My short-term memory is very bad. So when we talk about coming out of the pandemic and the healing process, and I have all that wrote down about the healing. There was no time to mourn. There was no counseling after the mourning. People lost whole families to this pandemic, whole families. One young lady talked about Reverend Barber and talked about being a part of the campaign because she lost everybody in her family. Have we stopped to think about 1.1 million people gone? I can't, the whole is so big, I can't even grasp it. You know, when you think about the number, yeah, thank you. The number of people that we've lost, and none of us were unscathed. Nobody that we know did not either lose somebody or know somebody that lost somebody very, very close. That pandemic, essential workers. My husband was a very essential worker. Nobody talks about those for real. My husband was a grave digger. He worked at the cemetery. He did not miss a day. He worked sometimes 7 days a week. And when people would say something to him about, you working, you still working, he's like, the people I work with already dead. And they thought he was being sarcastic, but he was saying that I have to work so hard and dig so many graves, that this how many people we losing. In a little small cemetery he was working in, they were having 15, 16 funerals a week. Yeah, I'm like, I mean, people need to sit with that for a minute. When you made that quote, I remember, I watched this, I binge this every now and then, this movie, Underground, that the legend singer produced, and they have a piece in there that Harriet Tubman is doing a speech, and she said something that just like struck me. She was like, a country that uses bodies for building will always require more bodies for the slaughter. They will always require more bodies. In the state of Alabama, our governor and other elected officials chose to take recovery money that was supposed to be used for us to recover from this pandemic and start building $1 billion prison. Expand Medicaid? Nah. Clean up the water in Lowndes County? Nah. Housing? Nah. Build a prison?
That's the part.
Yeah. Yeah, that's the part. And I tell people, when I talk about that at home, I say, this prison is already filled before it's built because of the overcrowding that we have. And when they open this prison, they're going to close 3 other prisons that's already overcrowded. Make me understand that. If you're already overcrowded, how can you close anything? And what I've learned from being a part, this is really educational journey in my being with the Poor People's Campaign since almost its inception, that I learned how to go back and fight. And it looks like I have some education, right, when I sit with these people with PhDs and all this, and I go back and I talk loud, because when I say something, I'm like Reverend Barber taught me a long time ago. If I'm loud, you can bet I'm right. Check it. Check it. The louder I get, the more you check. Yeah, because I'm going to be right about that. I am just dumbfounded about how life does not even have, and it should never have a price tag, but the price tag is so small on lives. Our children's lives, our parents' lives, our lives. And if nothing else, I pray that when you go back to your prospective homes, that you go back to, I'm not as nice as the other folks, because I don't have I'm not off the cloth. Fight like hell.
All right.
That's right.
Fight like hell. For not just your four and no more, but for everybody. See, I don't just do Medicaid dispatching. I just was in Alabama a couple weeks ago speaking about the death penalty. My husband and I have we work on a farm. So we have, everything we do is free. For folks that don't have food, we have well water, running water, we have stream. Everything that Poor People Campaign do, I have skin in the game. I support it. I have a grandson that's gay. Folks say, I thought you believe in this. I said, I do believe in it. I also know that love covers. Love covers a multitude of sin. And when they said, I said, thank you, Jesus, because I know that my sin was great. But because you covered it, I now can cover somebody else. Y'all better cover somebody else now. Yeah, you better cover somebody else.
You're doing a lot of covering here.
I'm trying my best because I want to hear, well done, thy good and faithful.
Amen.
I want to hear that.
Thank you.
You might not be able to see it in my life, but I hope you see it in my work. So, Medicaid expansion, it's just a part, like Reverend Barber said earlier, of the symptoms that is caused by poverty, greed, power control, and straight out hatred. Those are some of the symptoms caused by those things. For so long I lived by fear of what this man or that man gonna do. I believed all kind of lies. You come tell me something that make it sound like you kind of know what you was talking about. Yeah, and I believe that. Because you had on something or you hung out with some folks and I took you at your word. But then I learned, my grandson taught me how to Google stuff.
All right.
Now I'm telling you something about that technology. If you've been born, you can be Googled. You need to be careful what you do because they'll put it on the internet. And they say, you can delete it. They say, you can delete it, but you can't get rid of it because it's going to what they call a cloud.
It's out there.
It's out there forever. So, I'm grateful to be a part of such a trusting, truthful, strong group of people. Y'all look mighty good today. I'm glad y'all on my side the way y'all look.
Amen. Can I real quickly? So you're helping to highlight another part of fusion politics. So sometimes we talk about fusion, we talk about how we look, right? We're a fusion of everybody that makes up this country. That's important. But you're also saying these issues intersect and have to fuse together, right? All these things matter. So when we think about what we're talking about here, healthcare, ecological justice, sometimes those things don't go together. We're talking about them together. You're saying we got to take some action. So let me ask all of you, from the struggles you're within, the struggles you're studying, what are the actions that you are advocating for or working for or have policy proposals for that could make a real difference in terms of health outcomes for people in this country right now? What policies do you want to see?
In a nutshell, Medicaid expansion, universal health care for all. In a nutshell.
All right.
I just think that, you can't talk about life if you ain't trying to save it.
All right.
How you gonna talk about extending somebody's life if you don't care if they live or die? How you want me to cook food and you don't care if I had a cold, the flu, the virus or whatever. You don't care if I'm sick, if I'm cooking your food, handling your children. That says a lot about who you are. So health care, Medicaid expansion, universal health care.
All right.
To that point, I actually want to offer that during what we call the public health emergency for the pandemic, there was a lot of possibility because we did things that we said we couldn't do. So literally during the pandemic, because I would agree, healthcare for all, Medicaid expansion, all those things, and we literally did that when it was an emergency. And so I would say that we are in an emergency. We've always been in an emergency, especially in our community. So for example, during the pandemic, Medicaid enrollment grew by 23 million people to 95 million people between February 2020 and March 2023. That meant that 7.3 more children were covered by Medicaid, 15 million more adults were covered by Medicaid, 1.3 million adults with disabilities or over the age of 65 were added to the Medicaid rolls because we were in an emergency. Now, as of April 4th, 2024, because the emergency is over, We've disenrolled 19.6 million people that had coverage, continuous coverage because of this provision, right? So the thing is, we have the ability to do it. We have the resources to do it because we're funding wars. We're funding wars. So we have the resources to do it. We have the ability to do it. We did it during the pandemic, somewhat, not all the way. We did it. We expanded the ability for people to stay enrolled. And now we are disenrolling people, including 3.4 million children who have in the last year been disenrolled. How do you disenroll the people who have been most structurally harmed, right? In this country, we decide to disenroll. So we have this potential. It's not even like it's a pie in the sky kind of dream. We actually did it.
We've seen it.
We've seen it,
Yeah.
and so how do we do that, right? You talked earlier about, compared to other high-income countries, they all have better health systems, offer universal health care, but not even just high-income countries. So I do a lot of work in Brazil. Brazil is a low middle-income country that has universal health care, has a national health system. When I go there and travel, I can go to any hospital, get care, no problem. That's a low middle income, not with all the resources, power, et cetera, that we claim to have in this country. So it's not even, again, a pie-in-the-sky reality. It is a real possibility when we look to other nations who have prioritized the health of their people over profit. Because too often in this country, in this medical industrial complex that we have put profit over people. And we need to fix that.
Can I just say, I don't have the degrees and all that stuff, but when she went to talk about them babies, all the mamas stood up at me. I'm just wondering where the real mamas at. We supposed to have our pocketbooks and everything. We supposed to be standing at the White House every time somebody could open the door. We talking about our babies now. We talking about our babies. Babies don't deal in black, white, rich, poor. Babies deal in milk, formula, diapers, food, CBAT meat, what my pacifier. Babies. We talking about our babies. I'm looking for the mamas. I'm ready to go. Let's go. I'm looking for the mamas. I'm ready to go.
Yeah, amen.
Yeah, I'm looking for the mamas.
For the babies. Brother Wendsler, what do you think about in terms of policy action that this nation could take to address the evil that you were naming?
I think first, like what we're doing now is having this discussion that, we probably should have had a long time ago. I'm sure it was in the minds of the people, but I think we're all dissecting what was going on and why, like I was saying earlier, why our people were saying, what did we ever do, So I think now we're at the point that we have to say we don't understand. We can't say we don't understand. We do understand what's going on, and we have to be honest with it. So coming from our perspective as Native people, is you have to look at what the government's doing with the land, with the federal land. Now, I have a problem in Arizona. It's on federal land. You all have a say, even though it's in Arizona. But our people in America are taught that they don't have a say, yet they have a say. So what you see happening in the country is all these federal lands are dwindling away and going to corporations. Now you go to Rio Tinto, BHP, the biggest mining company that are here in America, that are buying up all the water pockets, buying up all these land. And our congressional people are allowing it to happen.
Yes.
So like for an example, they talk about the 100% copper that's going to be taken from our land, which is sacred. 75% is leaving this country. It's going to Asia. Any uranium they find is going to Iran, but you hear on the news how they're making us hate them. So when it comes back to looking at it from our point of view, is that we have to go back and relook at how this country was formed.
Exactly.
Because then we'll have answers from that point. Because it'll address every one of these issues. Because again, if all these lands are eaten up, the problems we're talking about here is going to continue and get worse. So from the Native perspective, we're at the edge of the cliff. And nobody is being truthful. Now, let me give you an example. I was eating at a restaurant in Globe, Arizona. Full, people were, it was full, it was an afternoon. People from Resolution Copper came in. So I normally am more disguised when you're dealing with mining and your life is threatened and you're shot at. So I really don't let people know who I am, but they recognize me. And anyway,
So everybody knows Resolution Copper is the company that's trying to dig under the holiest place in his tradition and have it sink into the ground. Just so they know.
yeah, and it's from Rio Tinto and BHP. And anyway, they came in. And the guy got up, and of course, he walked over in front of the whole people. He says to me, in front of the crowd, like you all, he says, so this is Wendsler Nosie stopping the economic engine of this country, stopping what you should have. So he named everything from computers to everything, from homes and things that we need copper for. So he said, this is the person. And then so I quietly got up, I looked at him, and I turned around, I looked at like all of you, and I said, he's talking about you. He's saying he's going to continue and continue and continue because America has a greed. We're greedy with power. We're not even looking at sustainability about what we have left. I said, once this mine goes, the whole Southwest is destroyed. Because these guys got exempt from all environmental laws. Congress gave them that. So now you have corporations across this country waiting for this to be done, officially given to them, so that they can eliminate or downwater the environmental loss. That's what America is going to face. And on top of that, we have our Christian belief as well, too, and native belief that's going to be destroyed, all in one. So when I look at these issues that we have in America, we have to go back and see where it was created and begin to fix it, because there's multiple medicine plants in these places that we still take. That when we look to the future, we're saying, man, they're going to want us to go to the pharmacy, they're going to want us to go to the groceries, and what kind of people are we going to be at that point? We know that sugar is a problem. A lot of our people are high on sugar. Nobody's saying anything about that. That's why there's the increase of illness that we have. So we get upset and looking at how this country formed itself, but we got to come back and remodify it so we can fix it for our children and those yet to be born, because those are the decisions we should be making.
Thank you. This is a rich conversation.
No, right?
We're asking everyone to close out these roundtables, to think about one question. So y'all been here all day. Y'all been thinking about this question. Let's say this time it's PBS. PBS is going to host it.
Okay.
Center for Public Theology and Public Policy is hosting a presidential forum. We'll start with you, Sister Callie. What's your one question for the candidates?
So, a little preamble to my question. So we all familiar with the crave and this quote that made somebody a multimillionaire. What would Jesus do? You all remember that?
Put it on the bracelets.
Yeah, and it was just popular, and everybody just jumped onto that. What would Jesus do, right? Like, this was the question of the century. What would Jesus do? And as I played with that question a little bit, I looked at my Bible, and when I read it, the question is not, what would Jesus do? I have that answer. Do y'all know what would Jesus do? You know the answer? You do? What is it? No, the answer is he's already did it. Right? That's the answer. Not just died on the cross. He did so much more stuff before he died on the cross. Right? He did so many more miracles before he died on the cross. So he already did it. So the question now does not become, what would Jesus do? Because he's already did it. The question for me, President Biden, is, what are you going to do with what Jesus had already done? That's the question I want to ask you, sir.
All right.
What are you going to do with what he's already done? And if you read your Bible, you know what those things are, and you know what is required of you. So what are you going to do now with what he's already done?
Absolutely.
Dr. Barber.
So my question would be very simple. I think it's tied to what Ms. Callie has said is, what are we waiting for? Or what are we waiting for? And the reason I say that is if the COVID-19 pandemic, the most profound public health crisis in 100 years, did not teach us anything, then I fear nothing else will. So what are we waiting for?
What are we waiting for?
Not now, when?
Dr. Nosie, you want us to remember the first chapter, and you get the last word.
My question to anyone that's running is, Mother Earth, what is she to you? Because for us, it's the greatest gift that God gave us all. Because within that, colonization and capitalism is intertwined. That has that domination over the earth. We are at a critical point in our lives as religious people and as people. And if we can't even stand up to God's words and Jesus' words, then what good are we? Because it's exactly what was said before. Are you standing on the side or are you a doer? And this work has taken me across the country because I've learned that in Europe, the white people have a culture. The African Americans have a culture from Africa, and so everybody else. So when I come back, I tell people in Arizona that are white or black, you're indigenous just like I am.
Okay.
What happened to you? What happened? Because those is how you're intertwined to the earth. What took that away from you? Because in the decision making that our leaders make, it's not about you anymore. As much as they don't care about me, they don't care about you.
You're right.
And if you're going to keep this system, then you need to fix it. We need to all fix it together. Because as Native people, we're tired of this. We're not going to stand back anymore because we're going to follow what the greatest gift was. And that's why I've always told Reverend Barber, I will be with you as long as you stay within that path of journey. Because that's who we are. So my mother used to tell me we were in one with God until this America came and spooked us. Just like probably all of you. And it took our attention away from who we're supposed to be. So now it's time for us to return to that day so that we can fix this country and around the world. Because why did God bring everybody to this country? There's almost everybody from different races here. People cried on the other side of the world for something better. So the evil that came here wiped 90% of us off the face of the earth. But those who prayed, those who believe, is why I'm still sitting here. But we have to now come together. So again, the question would be to them, as I said, Mother Earth, what is she to you?
What is she to you? Please join me in thanking all of these wonderful members, these moral voices on this round table. Thank you.
Oh, thank you. This was good.
Thank you both. Thank you.
Did you hear somebody?